Good morning. Thank you for joining us. This is the fourth webinar in our series, and we're so pleased to be offering and focusing today on best practices in teaching and working with patients and families in infection prevention and control. This webinar is part of, as I mentioned, a series that was supported by a grant, is supported by a grant from the U.S. Department of Health and Human Services Administration for Strategic Preparedness and Response, and administered by the New York City Department of Health and Mental Hygiene's Office of Emergency Preparedness and Response. We're real pleased to be offering a full range of activities through this funding. And this is, as I've said, the fourth of five webinars. Very pleased to welcome and recognize Fidel Monroe, the senior program manager long-term care in the Bureau of Healthcare and Community Readiness at the Office of Emergency Preparedness and Response in the New York City Department of Health and Mental Hygiene. And thank you, Fidel, for all your support and for joining us this morning. We're really enriched in our partnership with IPRO, both for this webinar and in other activities. And it's been a great collaboration. Sarah Butterfield, who's with us this morning, Terry Lebowski, who I don't know if she's on this particular webinar, and our speaker, Melanie Ronda. Melanie has been really a champion in this webinar series and is just such a wonderful expert. She is the Senior Healthcare Quality and Infection Prevention Leader at IPRO with more than 2 decades of experience across acute care and long-term care settings. Melanie serves as Senior Director of Healthcare Quality Improvement and Infection Preventionist at IPRO, where she leads large-scale quality improvement initiatives supporting hundreds of nursing homes across multiple states. Melanie's recognized for her expertise in infection prevention, regulatory readiness, and process improvement, with a proven track record of improving New York State survey outcomes. She is a frequent state and national speaker, has co-authored mandatory infection control education that meets New York State requirements, and is deeply committed to advancing patient safety and quality outcomes. So it's our pleasure, and we're so pleased to recognize and welcome Melanie this morning. Melanie, take it away.
Thank you, Peter. All right. Thank you, everyone, for joining. I would love for you to introduce yourselves in chat and to let us know what your role is at your organizations. So today we're going to talk about understanding best practice with teaching patients and families, explain why patient and family engagement in infection prevention is critical. We're going to demonstrate effective communication strategies to engage patient and families, and integrate engagement tactics into your agency's infection prevention control program. While we're talking about education and training our patients and families, I want to go back to why we're hosting this series. We're looking at identifying and understanding emerging infections that could be happening in our world, such as we experienced COVID-19. We've talked a lot about avian influenza during this time frame, and I like this quick review to talk about COVID-19, RSV, influenza, and the transmission that you can see with these areas and the symptoms that are a little bit different, but also similar. And then additionally, time from exposure to infection. So these are all different. 2 to 14 days for COVID, 4 to 6 days for RSV, and for influenza, it's 1 to 4 days. So when we start talking about infection prevention and control, being aware of the fact that symptoms can be similar and also different, and understanding time from exposure to infection is also varied. And when we're teaching and training, we need to make sure people are aware of these differences. So let's talk about effectively teaching patients and families. We all do this in some capacity in our roles, working with patients, working with staff, working with so many different types of people that we work with. But I want to just kind of establish a basic understanding of the best way of using evidence-based practice on teaching. So effectively teaching patients and families. Now we have the discussion to discuss infections. We are trying to prevent. Let's
No,
talk. Oh,
no.
I think
Oh,
somebody's
yeah.
off of mute.
Please make sure you all keep yourselves on mute so we don't have to force mute. Thank you.
Let's talk about how we effectively teach patients and families to prevent them. So, establishing a teaching environment. We want to make sure we set up the right situation to begin that training environment. Invite both patient and family caregivers to participate in infection control education. Set up a collaborative tone by framing them as partners in care. That's a really good way to look at the training. That families are partners in care with their loved ones. Tips for setting the stage. Build a rapport first. Start with friendly conversation. Acknowledge the family's caregiver efforts. Minimize distractions. That's so important. People learn in different ways, but having a lot of background noise can really distract someone. Or a lot of just a lot of chaos can cause distractions. Choose a quiet area, turn off the TV and radio, ensure good visibility and hearing. That's another thing to be cognizant of. Who are you speaking to and can they hear you? And do they need to see your mouth moving to fully understand the message you're trying to provide? Set a shared goal. So emphasize your mutual aim. What is the purpose of this conversation? Keeping the patient healthy at home and avoiding preventable hospital visits. That could be your goal. And also, and there could be other goals. Maybe it's a very small thing that you're trying to work on today, but what is the goal of the conversation? Maybe it's to reduce nurse visits and you need to teach somebody on how to do some wound care. Be mindful of family dynamics. Identify who is involved in daily care and engage all the key caregivers. So that's really important. You all walk into different environments all of the time. What is the dynamics of that family? Is it a neighbor that's visiting? And would your patient be comfortable for you to invite that neighbor to be part of the education and being a partner to that person's care? Your role from caregiver to educator. So we're going in as caregivers, but now we often have to maneuver and become that educator. Uh, One of the most important skills we bring to the role is how we communicate. Keep it simple, clear, and meaningful. Every home care visit is both a delivery opportunity and a teaching moment. You're there, there's a lot of things happening. You always have an opportunity to bring a teaching moment. Home care staff must provide individual assessment-based education that demonstrates clinical judgment rather than generic instructions. So that's one of your responsibilities. How are you providing the education to that patient and to that families? Identify early signs of infections. So this is another area we want to hone in on today, is making sure that not only the staff for the home care agency is familiar with infections and things to be alarmed with or concerned with, but you're providing that information to that patient and their families on what is a concern. When does it need to be escalated? When can they just call for one of you? When should they be calling the physician, or when should they be calling 911, frankly? These are all very important thoughts. Whoops, jumped. When we're training and speaking to patients and families, it's really important to use plain language. Keep language simple and jargon-free. Say germ instead of pathogens. Keep it clean instead of aseptic technique. Your families aren't going to know the differences. Always explain the why behind each practice. Gone are the days that people are told to do something and they just do it because a healthcare worker said it. It is really important that we make sure we explain the reason why we need to do things. Adults are more motivated when they see the reason. Link every action to its purpose. So we wash our hands before touching the wound so germs don't cause infections. That's an example. Limit information to 1 or 2 topics per session. People forget 40 to 80% of medical information after a visit. That's surprising, right? Think about that. If you go in and you're meeting with somebody who's a new diabetic and they also have a diabetic wound on their foot, and you're trying to provide them a lot of information at one time, that might be way too much for that time frame. It's best to talk about something, see if you can get some feedback on that, and then also leave resources. Prioritize the most essential points first. What do they have to know? Then you can get into some other levels of detail. Use everyday analogies to make concepts relatable, comparing hand washing to washing hands after gardening. So that's making that real, the sense of there's actually dirt on your hands, even though there are times where you can't see it. Think about anytime you're doing something dirty, it's like working in the garden. I like to think of ketchup. If ketchup was on my hands, how far would I spread it? Because it's bright. So thinking about those types of things, what kind of breakdown can you give to when you're trying to have a healthcare concept you're providing to a patient that will make it make sense to them? So demonstration and teach back are really important. Demonstrate skills by step using simple language while patients and families watch. So whatever that situation is, you want to make it simple and you want to do 1, 2, 3. Number the steps for clarity. Use teach back, and we're going to talk about teach back on a couple other slides, but ask them to show you how they do it or explain it back in their words. This confirms understanding, not just exposure. Create a no judgment atmosphere. This is very important. You want whoever you're trying to teach something, you want them to feel very comfortable in the environment you're creating. So no judgment, no facial expressions, no gasping. So sometimes when we're working with people, we're surprised maybe about the question or the misunderstandings, and we have to be very cognizant of how we look when somebody says something so that it's still a comfortable place. Encourage questions during practice and correct errors gently by redemonstrating. So if somebody does show you the technique they would use and there is an opportunity to improve, do it softly so that we're making sure we're teaching people the right way, but not harming the relationship. Supplement with visual aids and written handouts they can refer to later. So important to have those visual aids. Anytime you can come up with something that shows the process or explains this is clean, this is dirty, why wearing a mask is important. If you're teaching somebody about wearing a mask because we're going back, if we're thinking about respiratory virus, that picture of when somebody sneezes, I'm sure all of you have seen this picture, how far the droplets fly that's a really useful tool to explain why masking helps capture those droplets and also prevents you from breathing in those droplets. What is Teach Back? So let's just get into a little bit of what is Teach Back. Teach Back is an evidence-based health literacy intervention that promotes patient engagement, patient safety, adherence, and quality. The goal of Teach Back is to ensure that you have explained medical information clearly so that the patients and their families understand. So it's a helpful way to say, can you explain it back to me? Does this make sense to you? So you really are walking away knowing, yes, that person does know what I was trying to teach them. In Teach Back, you ask patients and family members to explain in their own words what they need to do, to need to know or do. It's more than repeating what they heard. You ask them to teach it back. Teach back is a strategy for you to validate that you have explained the information clearly and that patients and family members clearly understand what you have told them. Do you all already use the Teach Back method? It would be just interesting to know. Or is this an opportunity to kind of enhance your practice? Why use teachback? Research indicates that clinicians underestimate their patients' needs for information and overestimate their ability to communicate effectively with patients. I thought that was really interesting to think about that. We believe our patients don't need that much information, and then I am explaining it so well, they definitely understood that. And I realize in my own work that I communicate in one way, but there are a lot of people that communicate in different ways. I tend to not give a very thorough directions, 1, 2, 3, 4, 5. And some people really need the what I would put in 5 steps, they might need in 10 steps. So being familiar with who you're speaking to and really breaking it down to the level that you're speaking with is very important. In fact, in one study, up to 80% of the medical information patients were told during office visits were forgotten immediately. So that's pretty alarming. And in another study, nearly half of the information retained was incorrect. So that's another alarming. So really providing those handouts, which I have a lot of examples of handouts, will also be helpful. So if you have a new patient or someone with a new wound, maybe it's a patient you've been seeing, but a new wound, being prepared and having at the center of the agency, having support tools ready and available for your staff to bring with you, bring with them to provide that training is important in leaving those pamphlets. Patient misunderstandings and poor recall contribute to poor patient adherence and outcomes and readmissions. Teach Back is a proven strategy to ensure patients and their families clearly understand information you communicate with them. Finding ways to improve communications between you and your patients and their families can directly address patient safety problems. Really learning to communicate at the level that your patients and your families are is really important. Here's just another way to look at Teach Back. Chunk and teach information, ask patient to teach back in their own words, allow patients to consult material, and then reteach using different words if you need to. And then examples of teach back starters. So I liked this. I want to make sure we are on the same page. Can you tell me? I want to make sure that I explain things clearly. Can you explain to me? Can you show me how you would use your inhaler at home? That's a great one, actually. So often people do not use inhalers correctly. So just be thinking about and I'll have to look for the reference. I think this was on AHRQ. Um, Incorporate into daily routines. Help patients and families embed infection prevention into everyday routines rather than treating it as a special task. So that's really important as well. We should always be cognizant of infection prevention and control and in just what we're doing any day, especially as we see so many respiratory virus outbreaks and different things that are happening in our community. We're going to talk a little bit about measles in a few sections. So just being aware of what's going on, identify critical hand hygiene moments before meals, after toileting, before and after wound or catheter care. Place soap or sanitizer at these locations, model behaviors during visits, consistently perform hand hygiene and use PPE, explaining what you're doing and why. So while you're putting on the gown, while you're cleaning your hands, oh, just a minute, I want to clean my hands before I take a look at that or before I touch you. Just being aware of what you're doing and explaining that. Integrate cleaning into care routines, right? So wipe down a surface before setting up medications. That also helps people and explaining why you're doing it. I'm going to clean the counter down before I pour your medications, and they'll be ready for you over the next week. Tie new tasks to existing habits, add a wound check right after morning teeth brushing. So that's important. That's a nice thing to think about. If I do something every day, can I tie that new task? Maybe I get a coffee every morning, but I now am new to getting an insulin injection, and that would be the only way I might remember is I'm going to do my insulin before I drink my coffee. Point out subtle risk situations in home, pets, dusty supply storage, petting your animal and cleaning your hands, and teach prevention in context. It's really important that we as healthcare workers and possibly the trainers for our patients and our resident patients and our families respect culture and language differences. Cultural competency and language access are essential for effective teaching in diverse home care settings. So hopefully you have language lines set up, or you have people that are bilingual that will be able to communicate with your patients. Use professional interpreters and use translated materials. Don't rely on family members, especially children. That's really important. Children aren't going to understand all of the concepts you're trying to get out, depending on their age. And using that professional interpreter when you're trying to teach about healthcare is so, so important. Respect cultural health beliefs and traditional remedies. That can be another challenge depending on who you are, just understanding the differences and why somebody might do certain things from the cultural perspective. So be aware of that and respectful of that. Integrate infection control into those practices rather than dismissing them. So learn about the practices of that is specific for cultures and see how you can embed good infection prevention and control inside those practices. And be mindful of personal boundaries around gender, roles, and modesty. Adjust your approach as needed. Use show me methods like teach back to gauge comprehension, since some patients may nod politely without fully understanding. And that's really important. A lot of people nod their heads. So you think they're understanding what you're talking about, and very often it's just a process that they do. They're nodding their head yes, but they really might not know. Start with fundamentals and adjust upward, assuming no prior knowledge prevention prevents dangerous gaps. So that's really important too. So don't just assume people know because they've been a diabetic that they know all the things about diet. Start at the beginning and move up. So learning is ongoing. Reinforce key points at every visit. That's so important. Follow up on previous teaching and ask how things are going. So whoever was there last, whatever teaching plan they put in place, touch base, check in, make sure things are going well. If it was a nurse who did the teaching, but an aide's going in next time, have the nurse report off to the aide to say, I provided some wound care training. Just touch base and see if there's any other support that they need. Did they understand it? Are they struggling? Because maybe I need to come back as the nurse. Use memory aids between visits, so reminder signs by sinks if that's appropriate, stickers on pill organizers, pictogram checklists from CDC resources. I also have some resources as we go through this. Involve the families in tracking progress. So maybe you want a log sheet for dressing changes or hand hygiene. Whatever it is that you're trying to train folks on, maybe putting something out there that the families can fill in would be helpful. Designate a household infection control champion if that's appropriate. Maybe you have a very busy household and there's a lot of people in and out, and you want to just have one person that's going to really hone in on those infection control and prevention methods. Ask open-ended questions to identify challenges. What difficulties have you had with the precautions we discussed, and troubleshoot together? Document all patient and family education in the visit note or care plan after each teaching session. This helps for your next person who's coming in to provide care to know where you left off and be able to go back and reevaluate how the information's going. Record topics covered, patient family responses, and demonstrated understanding. Materials, also record materials provided. Note whether more teaching is needed and what to follow up on the next visit in case you're not the one who's going to be following up. Thorough documentation ensures continuation for the next visit for the clinicians, and also supports your documentation requirements. Actively invite questions throughout your teaching is so important. To ask questions, try to get feedback, ask what questions do you have rather than do you have any questions. So asking the right questions, important. What questions do you have? If you say, do you have any questions? People are more likely to say no or yes. It's um, listen without interrupting or judging. Gently clarify misinformation with evidence-based responses. If you don't know the evidence-based response, it's always appropriate to say, that's a great question, and I'm going to go back and do the research, and I'll bring it forward to you when I visit next time or the next person who visits. Be patient and compassionate. Acknowledge that learning new routines takes time and reassure them it becomes second nature with practice. So important to just be patient. Why infection prevention matters. Let's reconnect this to why we're talking about teaching infection prevention. Home care patients may be older and medically fragile. We know that. We want to prevent them from going to the emergency room or have hospital stays. Many infections can be prevented at home. And everyone plays a role in infection prevention. So you have patients, families, caregivers, your other healthcare team members are all part of it. Frame infection control as protecting the whole family, not just the patient. So the home infection control team is everyone. If you prevent an infection from the patient, it prevents it from the people in the home being exposed. Explain how practices like glove use and hand hygiene keep caregivers safe too. Encourage everyone in the household to follow the same practices, including visitors and children. Foster a team mindset by framing the family as the home infection control team. That sounds exciting, right? It's a home infection control team versus let me teach you about hand hygiene. I want to make sure we are creating a safe home infection control team. Kind of changes the feeling of that, right? Assign roles. Who's a hand washing coach, a wound care tracker? To make compliance a shared mission rather than a burden. I know it's not going to work in all families, of course, but it will work in some of your families, I'm sure. So examples of education. So I'm going to talk, I've got some specific things that I wanted to kind of highlight. Now we're going to look at some practical education, prevention in general, antibiotic stewardship. That is so important. Hand hygiene, cleaning, disinfecting, and respiratory etiquette. So vaccines. So vaccinations are so important for prevention. The other area for prevention and home care, stay home when sick. That's everyone, right? So hopefully, uh, grandma's little grandkids aren't coming in to visit when they have runny noses and they're sick, and just being really proactive about talking about illness with the families. And then healthy diet is so important for prevention also. So, talking a little bit here about immunization. So, immunizations are really important. Being aware of what the adult immunizations or the immunization schedule is in general, because you work with um, all all uh, all ages, but the adult immunizations are really important, and that's where we're getting into that COVID, influenza, pneumococcal vaccine, RSV, so important for the RSV. So here you can always go to the CDC, you can or ACIP, so the Adult Immunization Coalition, you can look at that. And this is the adult immunization schedule by age. It's a pamphlet that you can get. It's multiple pages, so you can look at that. I also was really excited to tell you that there's an app. So you can go to the CDC, you can find this app. So it's a CDC vaccine schedules for healthcare workers. And it might be nice for you just to download that so you can make sure that all of your residents or your patients are up to date with vaccines. It's a missed opportunity. I still believe we have a lot of opportunity to get out there, and we have a new patient, a new client. We want to know immunization status, and can we provide a vaccine that's going to prevent an illness, right? So, vaccines are, here's a couple resources, but we need to talk about measles. Anybody see any facts about measles in the news recently? You can put that in chat. So it's alarming. It's alarming to me that the measles cases in 2026, we've already had 30 outbreaks in 2026. The CDC updated their website today, and as of May 28th, 2026, 1,983 confirmed measles cases were reported in the United States in 2026. And they have been reported in New York City and in New York State. So this is important for you to be aware of, right? We need to make sure people are being vaccinated, and that's everybody's job. Anyone who works in healthcare needs to be aware that immunizations are important, and the measles outbreaks are linked to unvaccinated folks. So being aware of that is important. So I highly recommend that that is part of your screening protocols, to take a look at MMR vaccines. So measles, mumps, and rubella. So here are a couple resources that you could click on when you get the slide deck, and that could be helpful. If you have any questions about vaccines, go ahead and put that into chat. We're going to move to antibiotic stewardship and talk a little bit about that. So antibiotic stewardship, it starts with healthcare. It starts with anyone. Gone are the days where we just go to the doctor and say, I need an antibiotic, I don't feel good. Or hopefully gone are the days for that, because that became the problem with the multi-drug resistant organisms. People were getting antibiotics, they were starting them, They were getting them frequently, and like in the 60s, penicillin was given out like it was candy. And here we started to start seeing these resistant organisms, and there's more. There's always more resistant organisms coming down the pipeline. We must start focusing on antibiotic stewardship. This means that you all should be thinking about how are we communicating the need or the lack of need of an antibiotic. Antibiotics are only needed to treat certain infections caused by bacteria. Antibiotics do not treat infections caused by viruses. Important, and families need to know this, including respiratory illnesses such as the common cold or chest cold. Some bacterial infections, such as many sinus and some ear infections, can get better without antibiotics. This is really important for people to know too. There are times that you heal yourself. You don't need the antibiotic. Your doctor may prescribe antivirals for treatments for some viral infections like flu and COVID. And again, another way is just staying very up to date on your vaccines. I can't say enough about making sure you're up to date with vaccines. And I know it's a delicate situation right now, but we're seeing the impact with measles. Here are some resources that we thought were helpful. Viruses versus bacteria. What got you sick? This could be really helpful to leave with your families and with the patients, and maybe they've never seen something like this. Antibiotics are often prescribed when they're not needed for respiratory infections. Antibiotics are only needed for treating certain infections caused by bacteria. Viral illnesses cannot be treated with antibiotics. When an antibiotic is prescribed, ask your healthcare professional for tips on how to relieve symptoms, and always finish your antibiotic, right? So that if it was prescribed for 7 days, take it for 7 days. So many people I hear of say, oh, I didn't finish the antibiotic. I have some left. I'll just start it. I'm not feeling great today. How many of you hear this? This is common practice still. We need to get out there and get that message out there for antibiotic stewardship. Do antibiotics have side effects? Yeah, they do. And one of the things we really want to make sure is we don't get C. diff, right? So get medication, immediate medical help if you're experiencing severe diarrhea. It could be a sign of C. difficile. So very important that people realize that antibiotics are not harmless. There is a risk. What antibiotics resist bacteria? So the antibiotics can save lives, but anytime antibiotics are used, they can lead to antibiotic resistance. Antibiotic resistance occur when germs like bacteria and fungi develop the ability to defeat the drugs designed to kill them. If antibiotics lose their effectiveness, then we lose the ability to treat infections like those that lead to sepsis. Sepsis is life-threatening, right? We know that. We've talked about that. Sepsis is life-threatening. So we have got to keep antibiotics being used when it's appropriate, being completed as they're supposed to be. So we continue to have antibiotics available to us. Here's another really nice resource. So we have a lot of resources for you in this slide deck. Preventing and treating the common cold. It's really helpful because so often somebody has a cold, like I got to go get the antibiotic, but do you? And this is a nice flyer to hand out. General infection control, make it personal and specific. Again, some resources I provided, featured campaigns, health communication from the CDC. Where do germs live in healthcare interactive scenario? That's from Project First Line. Project First Line has a lot of great resources for basic knowledge on infection prevention and control. You can look up a variety of different things on the website, and you'll be able to find some resources to help with training your staff as well. So it's not just patients and families, it's staff too. Hand hygiene. Many diseases and conditions are spread by not washing hands with soap and water and clean running water. So that is something we've talked about quite a bit throughout the series, is alcohol-based hand rub is a really good choice. You are walking into a lot of different environments where maybe soap and water washing isn't going to be your best place. There's no place to properly clean your hands, no place to properly dry your hands, no soap available unless your agency provided it. So what are you telling your families about this? What if there isn't any soap? Are you leaving soap behind? How are you managing if there's lack of water? Maybe that could be a problem. How are you going to train your families to keep their hands clean before they touch wounds or do something? CDC recommends cleaning hands in a specific way to avoid getting sick and spreading germs. And some of the resources will show that. You'll have a resource to provide to the families on what that is. The recommendations for effective hand washing and use of hand sanitizer was developed on data from a number of studies. Learn more about the science behind how to wash your hands and why with the hand washing fact sheet. So I provided that to you. So you'll be able to use that with teaching. Hand hygiene for patients and families. Here are some additional tools for you. You can look through, see what makes sense, wash your hands, what you need to know about hand washing, another wash your hands, and wash away the germs. This is a really nice resource that was created with IPRO and HCA. So hand hygiene. Hand hygiene means cleaning your hands by using either hand washing with soap and water or alcohol hand gel. And this kind of goes through the whole when to do it. And it's helpful for caregivers, but it also would be helpful for your families and patients. So I thought some other areas you might be trying to teach is teaching wound care and device management. So catheter infections. When are you teaching something about catheter infections? What are they looking for? So warning signs, fever, cloudy, bloody urine, pain, strong odor, urethral discharge, wounds infections, increased redness, swelling, warmth, pus, drainage, fever, delayed healing, IV site infections, redness, swelling, pain, warmth, red streaks along veins, external rotators, that's pins. I think about that. I did some home care when I was in the past, and I had somebody with a halo, and she started to get a pin infection. So we identified that. We were able to her mom actually noticed. She was a young girl, and her mom noticed that she had some redness. I looked at it. We were able to send her off. She needed to go see her doctor right away for the pin infection. But just being aware and teaching people what to be looking for is so important. And catheter care, teach patients to keep the bag below the bladder, so important. Empty regularly and wash their hands before and after. Wound dressing changes require clean technique. Teach families to prepare a clean surface. Avoid touching the wound with bare hands. Demonstrate proper technique first, then have families practice while you observe and provide feedback. And you may need to do the teach back method multiple times, right? Because doing a wound the right way might be a very foreign process for your families. Create simple written instructions for families, can reference between visits, include photos if helpful. Do you all write out the instructions, or do you have most things that are printable that you leave? How are you managing what you're leaving with your folks? Uh, so cleaning and disinfecting, they're two different things. And I'm not sure that everyone understands that that doesn't work in healthcare. So cleaning is when you remove materials like dirt and soil, other contaminants from the surface. You clean down your kitchen table after dinner to remove the leftover, especially if you have a toddler, right? You're going to clean down that surface. You want to get all the leftover food off. People usually clean with dish soap and water. Routine cleaning will reduce how much the virus is on the surface or object. When there are fewer germs on the surface, you reduce your risk to exposure. So you're wiping it down, you're cleaning it down, and maybe that's clean enough. But if you have a toddler with a runny nose and coughing and sneezing, you might want to clean everything down, and then you may want to disinfect, because you disinfecting is when you use chemicals to reduce or kill things like bacteria and viruses from the surfaces. Disinfecting kills many germs or stops them from reproducing. And so I did find this nice link, So Healthy Home Guide to Cleaning and Disinfecting, and it's a PDF, and you can take a look at that. And I'm having trouble getting the chat to pop up. So I'm sorry if I'm missing what you all are saying. Oh, here, I think I got it. So sorry about that. I have missed. So print out and highlight key points. Yes, that's important. So that's what you're leaving behind. You print out things. And is there a resource you all go to, or you just Google and find resources on wound care management or hand hygiene or cleaning and disinfecting? How are you doing that? So common disinfecting households. So I found some interesting information on the cleaning and disinfecting and I've got a slide on that, but I just wanted to talk a little bit about what people are using. So sodium hypochlorite, that's household bleach. Bleach is dangerous. So this is, you shouldn't just be pouring bleach on things, right? Bleach is dangerous and should be used carefully and only when necessary, following the steps listed below and all label and safety information. So being aware, this is all from that resource that you will have access to. It's on the slide before. So quaternary ammonium compounds, quants can be bad for you. Follow all label and safety information. Quants is something we usually use inside a healthcare setting. And then alcohol sanitizer, rubbing alcohol, they're flammable. So that's another risk. And then hydrogen peroxide, peroxide cleaning products and antiseptics do not mix with vinegar. So a funny story, which is not funny, I was probably about 10 years old and thought I was doing a great thing by cleaning the bathroom. I was scrubbing the floor. I found some ammonia and I found some bleach and had poured them together and had the smoke that came out of it. So thankfully it was very light and was able to clear it all out, but I didn't know any better. And from what I understand, that's the reality. A lot of people don't know any better. So cleaning, what is already known about this topic, this is also from that resource. So knowledge and practice regarding safe household cleaning and disinfectant for COVID-19. So just something for you to be aware of. I want to go to this next slide. Oh, it's jumping slides. Did it jump?
Melanie, I do mean to interrupt if I'm interrupting, but I apologize for interrupting. I have in the chat and I will launch it in the chat the infection control resource tools that HCA had published. If this is bad timing, I can defer it. I just wanted to mention it to you.
Oh, no, go ahead and put it in.
It's actually a document people would need to download. We weren't able to
Okay.
identify the link, so
Oh,
thanks.
great. Yes. So you please download that. It's a nice resource. What is already known about the topic? What is added? Oh, so an internet panel survey identified gaps in knowledge about safe preparation, use, and storage of cleaners and disinfectants. Approximately 1/3 of survey respondents engaged in a non-recommended high-risk practice with the intent of preventing SARS-CoV-2 transmission, including using bleach on food products, applying household cleaners and disinfectant products to skin, and inhaling or ingesting cleaners and disinfectants. This is alarming. And this is, again, thinking about the reason why we're putting on this presentation, or we're talking about emerging infections. We want to make sure we provide education and training for people to not do dangerous things. Even if there is a new pandemic or a different event that happens, people need to watch and wait. And our traditional cleaners are what we should be using, and we should not be using them outside of the normal way, like putting them on food. Certainly very scary to think about the impact of that, right? So public messaging should continue to emphasize evidence-based safe cleaning and disinfection practices to prevent SARS-CoV-2 transmission in households, including hand hygiene and cleaning and disinfecting. The other area I just wanted to spend a little time on is respiratory etiquette. So respiratory hygiene in home care. Cover your cough and sneeze. It's an easy thing for us to train everybody on how to manage covering our coughs and sneezing. Cover your cough, sneeze, dispose of tissues promptly, perform hand hygiene, mask when symptomatic, stay home if you're sick. I'm sure you have seen this before, but to be aware, to get out there and train your families and patients on it is really important, because people do very different things. If somebody's sick, it might be a big pile of tissues on the couch or the bed. And really all we might need to do is bring a trash container closer to the person so the tissues go in there. So it's just another resource. This is a micro learning from Project First Line Cough and Congestion. Personal protective equipment, masking, and this link is respirators and mask types, and this is for the common person, so it's not for healthcare workers. But we see, and I'm sure you all are still seeing, that people wearing masks, they wear it all day, they wear it out in the heat, they wear it, and they're not changing them that frequently, and it still concerns me that people are not using infection control with the mask. They're wearing the mask, but there are times you should be disposing of it. You should be getting new masks. You shouldn't keep using the same mask. So gloves, it's important if people are wearing gloves, they have the right fit, the right purpose, the right kind, and understand the risk. So if you have your families wearing gloves, because they're doing care for their loved one, making sure they understand which kind for what they're doing is important. And we have talked about this throughout this training. Most home care waste, you use gloves, bandage wrappers, lightly soiled gauze. It's regular household trash, but how are you managing that? I do think it's important if you have somebody who uses needles or has sharp devices that they're using, that you to spend some time talking to them about sharp devices and how to dispose of them properly. And if somebody's their caregiver, and maybe you have a resident, a patient that has C. diff, and who's managing their laundry, and how are you managing cleaning that household? That's something to think about. So, and it's always a good thing to talk about safe injections, help ensure patient safety, make every injection a safe one needle, one syringe, one time, and making sure your patients know to not reuse needles. That's not good practice, is really important, and how to properly dispose of them. And then when you have a filled container, what to do with them. So key takeaways, effective infection prevention starts with education. Patients and families must understand not just what to do, but why it matters. Use clear, simple communication, plain language, and focused teaching improves understanding and retention. Confirm understanding with teach back. Don't assume. Ask patients and families to demonstrate and explain. Make infection prevention part of daily routines. Tie practices to real life habits. Engage the whole household. So that whole infection, it's the whole team for the patient. Engage, reinforce, document, and build over time. Your role is to empower, not just to instruct. So, oops. I have, well, just a couple minutes for questions. And I'm going to move to this as well, so you can scan this QR code.
Thank you for that.
Mhm.
Folks, we do have a couple of minutes. So, are there questions? I know there was some earlier discussion around recent increases in measles and measles outbreaks and the reduced uptake in in vaccine and vaccinations. That is a big driver of this. Any thoughts or questions on that topic or any of the other areas that we've covered? It's been an excellent overview. Thank you so much, Melanie. But we do have a couple of minutes, so.
If you have any questions, you can put them in the chat or you can simply unmute yourself.
Well, if there are not, and I tend to not allow as much silence perhaps as might be helpful, but I don't want to belabor the point. I really look forward to getting your feedback. The prior slide had a QR code and a link, and you'll also see when you exit the seminar, the webinar, a link will launch. And it is an opportunity. Thank you, Mel, for the next slide, which refers to an upcoming event that we have on June 23rd, which is the best practices for communication, collaboration, and coordination among home and community-based service agencies. For emerging infectious disease, and that will be the capstone of our series. You will all be receiving the slide deck, and again, we look forward to your feedback, and we appreciate your participation. Thank you, Mel, for an excellent presentation, and
Thank you.
have a great day, everyone.
Thank you, Mel.
Thank